Hi, I'm Jared Christian. I'm a second-year MPH disaster management student here at Celia Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University. Today I am with Dr. Stephen Murphy. He is the director of the Health Security Program here. Dr. Murphy, how are you?
I'm good, Jared. Thanks for having me today.
Yeah, of course. Thank you for joining me. Can you give a little bit of background into where did you start, but also how you got to where you are now?
Yeah, sure, Jared. So my path was extremely nonlinear. Way back, I had an undergraduate degree in economics, and I went on into a financial management, asset wealth management type career for a little while. And then the events of 9/11, including the anthrax mailing shortly thereafter, impacted me to the point that I wanted to change my career. It was a little bit of a slow roll for me to change my career at that point, but it was intentional. Everything I did was intentional. I went back and pursued an MBA. And within that, I thought that if I did not get myself into a career that would help me either prepare for or be a part of the response cadre to events like 9/11 and those anthrax mailings, if I did not find that solution, then I would at least have an MBA that would continue my financial career. So it made a little bit of sense to me being a contingency type person. As I did that, I found myself drawn to more of the public health side, with my MBA focusing also on healthcare management. And so I arrived at Tulane, and shortly after my arrival here in New Orleans in 2005, Hurricane Katrina happened. And so I found myself at another institution and studied there for a while, returned to New Orleans when the doors were reopened at Tulane, finished here and immediately began working at the city's Homeland Security Emergency Preparedness Office, which was a new office founded after the hurricane itself. And its mission was the entirety of what you and I have been studying together in the curriculum. Soup to nuts, all emergency preparedness, including a lot of the public health preparedness initiatives shortly after Katrina. That changed over time, but our office was tasked with all of that. And I was very, very proud and honored to be a part of that shift in New Orleans and the growth and rebirth after Katrina. I mentored a lot of students in your shoes during that time. And I stayed very plugged into the curriculum, and I stayed very plugged into that component of your curriculum and trying to also improve the curriculum based on my interactions and my mentorship and preceptorships with those students. And so being plugged into the curriculum that entire time, it was a natural drift for me to go back to school. And when I did, after a good decade of work, I finished my PhD here in your department, and was immediately placed on the directorship path. And now I direct the program that I graduated from that you're currently enrolled in.
All right. Well, thank you for that. Another question that I have for you, how did the COVID-19 pandemic impact the field, but also what you study and the curriculum here?
Yeah, that's a really good question. The pandemic created a lot of challenges for the entire global society. But looking at it from an academic perspective, how do we integrate some of this into our curriculum? Because this is only a matter of when, not if, this will happen again. And so we learned a lot as a public health enterprise. We learned a lot in the healthcare component as well. But what we tried to do, and what I'm trying to do now with the curriculum, is infuse some of those lessons learned into the program so that when you get out, for example, when you graduate, you've got that in your toolkit as well. Very few people have lived through a pandemic, and so it's important for us to learn and grow from that pandemic so that we are better prepared for the next time that it does happen.
Are there other threats or other things that are upcoming that you think that people who are in the field should be looking at or studying? What can students hope to talk about in their classes?
Yeah, that's always a challenging question to answer, because there are a lot of, the threat landscape is very large, and it really is geographically challenged, if you will. For example, the West Coast probably doesn't worry about hurricane season a whole lot. But we're in New Orleans, and we came out of Hurricane Katrina and some of the worst hurricanes that the United States has ever experienced. And so it's important for us to learn from those events. The climate changing not in favor of hurricane season. They're only going to become stronger. The data is out there that suggests that there is going to be an increase, or there is currently a trend increasing major hurricanes. The rapid intensification challenges that presents a very, very difficult decision timeline. If you're going to evacuate from your threat zone, your timeline is now completely compromised because of that rapid intensification. So these are the types of things that we're really focused on here in New Orleans. Now, we're not ignoring the other threats. We're very focused on what those threats may be. And if there is a novel situation like the pandemic that might come about again, when it does come about again, we want to make sure that our students have an understanding of what that looks like.
As of right now, what areas of public health are you presently working in? What are you looking at? What's going on in the world?
Yeah, that's a good question. And so my primary focus is really at the intersection of applied science, research science, and in the practice space. And so one of the biggest initiatives that I'm currently involved in is in enhancing the public health workforce. And that's from A to Z, public health workforce from A to Z. But also there's another initiative that is specific to health security. And that's really where I want to spend my time. We are looking at ways to improve from a regional perspective, the relationships, the force multipliers that can be out there, better understanding who's going to come and assist you should you need anyone else, any type of expertise, any type of data collection, data analysis, data synthesis, in order to see a clearer picture of what may be happening during a crisis moment, or how you might position yourself to better understand a crisis moment, even though it hasn't occurred, on that left side, the preparedness side, rather than the response side, so that you can make those relationships a little bit stronger before the time is actually needed for them to be strong. And really that's where we're going in the regional approach of that. It's a CDC initiative that we just were awarded to from a 5-year award for Region 6. And that's Texas, Arkansas, Louisiana, Oklahoma, New Mexico.
Well, congratulations on that. Do you have any advice for any potential students that are interested in the program or students interested in the field?
Yeah, that's a really good question. I get that quite a bit. And one of the biggest things that I personally experienced was to find the passion. Find some sort of passion and let that passion lead you through a mission. Those that are more passionate about what they're studying in graduate school tend to get more out of it. And they end up landing a position upon graduation that is extremely successful for them. It's a great position for them to get out into the field. It's really a leader, emerging leader type of work. And so it's really important to find that passion, anchor yourself to it, tether yourself to it. Don't be inflexible, but just at least have a passion so that when you leave this program and this school, you are ready to hit the ground running.
With recent events, with the COVID-19 pandemic, and with what you mentioned with hurricanes and other recent disasters, can you speak a little bit to the misinformation and disinformation that surround these types of events?
Wow, how much time do we have?
That's a great question.
That's a very difficult situation. I often tell my students, you're entering the field of public health in a very difficult time. You're going to have a very significant amount of distrust in the public sphere. And so what we try to do in our curriculum, one of the things that we actually do in multiple classes, but there is actually a dedicated class to this, and understanding how to communicate, translate some of the science that is out there and communicate the actual facts to the general public, also horizontally and vertically in your leadership and organizational structure, so that you're probably taking a different tone and a different message, but you're making sure the facts remain static and that they're there and communicated properly so that the general public has an idea of what's going on. They have to be able to trust us, and that's the biggest message. I think we've seen some failure in some of the communication challenges in recent, we'll just go back a decade without calling attention to specific events. But regardless, I think that communication is paramount. And without it, you can't expect the general public to do what you're expecting them to do from a life safety perspective. They have to listen to you as the person that's going to be guiding them to a safer, or maybe protecting their health during a current moment of crisis. And if they aren't listening, or if they aren't trusting you, then that's creating a whole different layer of disaster.
What areas of public health are you working in now? And also, how can students get involved in that?
So right now, I'm currently the director of 2 federally funded centers. One is by HRSA, and it's the Region 6 Public Health Training Center. and actually we call it the Region 6 South Central Public Health Training Center. But in the HRSA tone, it's public health training centers. There's 10 of us across the United States. In every region, the United States is broken down into 10 regions, federal regions. And within that, we really promote a workforce development, professional development kind of strategy to approach the current public health workforce, the current healthcare workforce, the current primary care workforce, any and all folks that have a stake in public health delivery. And so we're trying to improve the systems of public health through the workforce development strategy. We currently have our own learning management system that is run by my center downstairs in this building. And looking at our learning management system, we have 225 plus active courses on it that anyone can take 24/7, 365, anywhere across the globe. We do not charge a fee for this. It is free for anyone. You just have to register for it so that we know who you are taking our courses and we can actually promote that. And so we have certain states that come in and take our courses. And one area that I'm also interested in, as you probably know, is the health security and the disaster space. And so a few of those courses are dedicated to that space of public health. And we have a few states across our country that actually come and take those courses as an annual training requirement and as an onboarding requirement for their entire public health workforce every year. And so double dipping, if you will, in that sense. So let's peel out the current funded Region 6 Center for Health Security and Response Readiness. That one was just funded and it's got a totally different approach. We are looking at how to improve the regional capacity to overcome any and all crises that they may face. Now, we can't go through every crisis that's out there. That's going to be impossible. That would take us forever, and we just don't have that type of time or personnel. So what we're doing is a very focused approach in looking at some of the lessons that have come out of recent disasters and trying to peel them out into an all hazards kind of element to where we can see, is there a data gap, for example? How can we better share data in order to make better informed, data-driven decisions during a moment of crisis? Where does that data live? How do we marry it up with other databases that are out there that we currently have? Does someone else collect a certain amount of data that we don't know about in Region 6? Maybe we can partner with them a little bit better to smooth out some of those wrinkles that we identify. We also want to look at some of the training that's going on in our emergency preparedness, in our health security enterprise within public health and across the board. So how are we actually learning any of these lessons that we've experienced? How are we actually promoting leadership for emerging leaders? How are we taking some of these obvious training elements and obvious lessons learned in our history as well as in public health, but also beyond? And how are we making sure that our public health workforce is prepared for the next time? We have a tremendous amount of workforce attrition following the COVID-19 pandemic. And we need to make sure that we are making every attempt possible to create an opportunity and make sure and sustain our current health workforce, create that opportunity to where they feel supported. And these types of trainings and professional development from a leadership perspective, from a, maybe a content area perspective can help. And that's where our Region 6 Center for Health Security and Response Readiness is going to spend a lot of time in looking at that data infusion and some of those leadership training, scenario-based leadership training ideas. Both of those, the Region 6 Public Health Training Center and the Region 6 Center for Health Security and Response Readiness, funded by the CDC, will have opportunities for students to play. We bring students into the mix quite often through the Public Health Training Center across the entire Region 6 platform. And we actually mentor at least 30 or more students in that arena alone. We have certain billets that are dedicated to student involvement for the new Center for Health Security and Response Readiness as well. And what they would probably get involved with would just be the experience of listening to the practitioner, because this center is practice-based. It's going to be listening to the people that actually are responsible for this mission in their state, at the state level, or in their community underneath that state level. And so it's going to be the practitioner that's going to be working directly with us. And so those students can listen to these problems and listen to these solutions and the evidence base that we're trying to create and promote. They can help organize a lot of these events too, because we're going to be having on-site scenario-based trainings with some of these healthcare and public health workforces as well. So those are just a few sprinkled in there of how students can get involved and a little bit of what my time looks like here at Tulane.
Well, thank you so much for having me, Dr. Murphy. It's always nice talking to you, and I appreciate everything that you do for me.
Great. Thank you, Jared. Thanks for having me. This has been wonderful.